Hi, I'm Dr. Kim Langdon with CCM Health, and I'm here to talk today about heart failure, why it happens, what are some of the things you can do to prevent it, some of the ways to diagnose it, and some of the ways to treat it. So let's get started. So what is heart failure? Well, like any organ associated with failure, it just means the heart isn't working very well. Of course, complete heart failure means that you're no longer alive. But in any case, it means that the heart isn't pumping well or as well as it should be. Your body depends on the pumping action of the heart to send oxygen and nutrients around the body, as well as return toxins and carbon dioxide back to the lungs. So with heart failure, the weakened heart can't supply the cells with enough blood that has vital nutrients. So it makes everyday activities such as walking, climbing stairs, that just the basic activities very difficult. So as you can see here, a healthy heart is a strong muscular pump. It's about the size, bigger than a fist, and it pumps continuously. It has 4 chambers. 2 upper chambers are called the atria. They receive blood. The right atria receives it from the body, and the left atria receives the blood from the lungs. Both the ventricles pump blood. The right ventricle pumps blood to the lungs to get oxygen, and the left ventricle pumps that oxygenated blood out to the rest of the body. So I sort of explained that there in a little more simply. But heart failure is a chronic progressive condition in which the heart muscle, the right side, the left side, or the whole heart might not be able to pump blood well enough to get enough oxygen to the body. And so the body compensates to this, and sometimes they're not even aware that their heart is failing until it becomes very severe and symptomatic. It usually affects the left side first, though. Any of the following conditions can weaken the heart. Coronary artery disease can lead to heart attacks. When you have coronary artery disease, it means you have a buildup of plaque or cholesterol and fats and calcium and things that restrict the flow of blood to your heart. Because just like other organs have their own blood supply, the heart has its own blood supply. So when those arteries are clogged, there's less blood flow to the heart muscle. High blood pressure can also cause problems because this extra exertion makes the heart have to pump harder in order to get the blood throughout the body. You can also have heart failure from faulty heart valves. The valves are responsible for deciding when blood goes from the atrium to the ventricle, from the ventricle to the lungs, or out to the body. So when they're leaky, they can put extra strain on the heart. And then the heart muscle itself can develop what's called a cardiomyopathy. It can be caused by infections, alcohol abuse, drug abuse, such as cocaine. Some chemotherapies can do that. And of course, genetics play a role as well. Myocarditis is inflammation of the heart muscle. It's commonly caused by a virus. You can also be born with congenital heart defects. That could be valves that aren't functioning, or the fact that you could have holes connecting the 2 atria or ventricle abnormally. You might have a problem with heart rhythm, which is due to damage to the electrical system of the heart. It may cause a slow heartbeat, which can lead the heart to have to pump harder. Other diseases like diabetes, HIV, excess thyroid, so hyper or hypothyroidism, iron buildup, protein buildup. There are many conditions that can lead to chronic heart disease that can damage the heart muscle. There's some medications listed there, as you can see. Any drug is a potential, especially at incorrect doses. Sleep apnea is commonly found in people who have obesity and don't sleep well, often stop breathing in the middle of the night, and this puts extra strain on the heart. As I mentioned, congenital heart defects, valvular disease, viruses, alcohol, tobacco, and obesity all increase your risk of heart failure. So some of the signs and symptoms of heart failure are things like shortness of breath. It could be while you're just sitting or lying down. It could be just with walking. You can get swelling or fluid build up in your legs, ankles, and feet. You can have fatigue and weakness, a rapid, irregular heartbeat, an inability to do exercise. You might cough a lot or wheeze or spit up blood-tinged phlegm. You might have to get up a lot in the middle of the night to urinate to relieve your body of excess fluid. You can get a very rapid weight gain from fluid retention if there's an acute failure of the heart. You might have concentration problems, and you could have chest pain that could lead to heart attack. In many cases, heart attacks lead to muscle damage, which then lead to heart failure, but they're each can cause the other. So acute complications, if you're not pumping enough blood to the vital organs, you could actually destroy your kidneys. So they could be damaged or could fail. You can get liver damage as well. Your valves could get extra strain on them, so they could start getting leaky if the heart starts to dilate or the muscles become too enlarged. You can have backup of fluid in your lungs called pleural effusions. You can also get pleural edema. So effusions are fluid around the lining of the lungs compressing inwards, and edema of the lungs is where the fluid is inside of the lungs, preventing blood flow and oxygenation. Chronic complications could be something as simple or as severe as chronic kidney disease. Atrial fibrillation is very common. That's a disturbance of the electrical system. It can precipitate heart failure, or it can be the result of heart failure. And predisposing factors could be mitral valve disease, excess thyroid, sinus node disease, which is the part of the electrical system of the heart. And you might have really low heart rates called bradycardias. So most people with heart failure, this tends to be a gradual problem. You can live a perfectly normal life if you take your medications and follow your doctor's guidelines and have the support of your family and friends. So there's lots of ways we diagnose heart failure. One of the most common is chest x-ray, electrocardiogram, or an ECG, EKG. That determines your electrical conduction and see if you're having any heart rhythm problems. Blood test, that big long term up there is one they can use. That probably wouldn't be the first line. An echocardiogram is like an ultrasound of the heart. So it's a video image of the heart to see the size and shape, to see if the valves are working properly. And then there's a stress test that you might be asked to do, which is where you're on an exercise machine and hooked up to an EKG machine. And so they see if by exercising that stresses or changes the heart rhythm in any way. Cardiac CTs or MRIs are two other ways that you can collect images of the heart and the chest. Coronary angiogram is actually when a thin, catheter, like an IV tube, is inserted into one of your veins, and then a guide wire is sent to your heart. They inject some what's called contrast fluid so that they can see if there's any blockage in any of the coronary arteries, and they can see that on X-ray. Biopsies of the heart muscle are rare, but may be done in unusual cases. So there's classes of heart failure based on your symptoms, and they're 1, 2, 3, and 4. Makes sense that 1 is the mildest and 4 is the most severe. Be interesting to see that class 1, you really don't have any symptoms, so it's hard to know if you would really have heart failure without any symptoms, but it might be diagnosed inadvertently on an EKG or some other testing modality, and yet you're asymptomatic. So then with class 2, you have slight limitation of your physical activity, but you're generally comfortable at rest. You might have a little shortness of breath if you exert yourself. In class 3, it would mean that, with even mild exertion, you have pretty significant symptoms. But you may still be comfortable at rest. And with class 4, you're unable to carry out most physical activities without having severe discomfort. And you may even have symptoms while you're resting. So then there's an objective assessment. And those are labeled A, B, C, and D. So it basically, you're usually put into a functional category of 1 through 4 and an objective assessment based on A through D. So basically it says, let's say you have minimal or no symptoms, but we've diagnosed on a test that you have a large pressure gradient across the aortic valve or severe obstruction of your left main coronary artery. So because of that, you'd be functional class capacity 1, but objective assessment would be D due to the findings on the diagnostic test. On the other hand, you could have very severe anginal syndrome, that's, chest pain, but your arteries may be completely normal by angiography. So that could be a functional capacity 4, but your arteries are clear. Quite a paradox. Of course, there's medications are our primary treatment. The angiotensin converting enzyme inhibitors and the angiotensin 2 receptor blockers, they are both used for heart failure. They're not used combined generally. They're also used for high blood pressure, which is often found either preceding heart failure or after heart failure is diagnosed. Beta blockers help slow your heart rate. That may be important to allow the heart to fill adequately, because there's no sense in pumping blood out if the ventricles aren't full of oxygenated blood. So it may slow that down to give your heart a chance to recover. Diuretics are often called water pills. When your heart fails, you tend to retain fluid in your extremities, sometimes in your lungs, more likely in your hands and your feet. That's why people can get, pitting edema in their ankles and calves and feet. So this will help take extra fluid off. As you take extra fluid off, you reduce the pumping effort that the heart must do. Then there's aldosterone antagonists. Again, they're a form of diuretic that work a different mechanism. Digoxin is something that helps your heart pump more effectively. And then there's surgery and medical devices. So let's say you have a blockage of one of your coronary arteries. Depending on where it is and how blocked it is, a coronary bypass surgery might be offered, or you might be have a catheter placed to bypass the blockage. Heart valve repair or replacement, you can have that done depending on what the problem is. You can have your valve actually replaced, or it can be surgically repaired. Just sometimes it just needs to be brought together so that there's no leakage. And then sometimes they have to tighten or replace the ring around the valve, called an annuloplasty. An implantable cardioverter defibrillator. Basically what this is something implanted in you that acts just like an external defibrillator. Those things you see on TV, those paddles when the doctors come running to restart your heart. Well, you can do it externally, or once your arrhythmia is diagnosed, you can have it implanted, and then it automatically detects whether you're having some sort of problem with the heart electrical conduction, or if your heart actually stops beating, and it will automatically defibrillate the heart muscle. It's a lifesaver. There's also something called there's pacemakers and there's biventricular pacemaking, very, high-tech stuff, depending on what sort of electrical disturbance you might have. Because if you have an enlarged heart, you've stretched out sort of the electrical connections. So sometimes they misfire and need help. On the other hand, ventricular assist devices, VADs, they actually help your heart muscle pump better. So it has nothing to do with the electrical system. It just makes it pump better. And these were devices that were used for people who were on heart transplant lists waiting to get a transplant so that it helped keep them alive. And then there's heart transplants for those who, are doing quite poorly and aren't responding to the other therapies. So as we talked about, there's the list of the angiotensin converter enzymes, ACE inhibitors they're called. They all look like Oprils. Everything's an Opril. So if you see an Opril or an April, it's an ACE inhibitor. Then there's, so what are the interactions? So of course, there's always a possibility of a drug interaction. So as you can see, quinapril can impair the uptake of tetracycline, an antibiotic. They can also raise your potassium levels, and other drugs like lithium can interact with them as well as simple things like over-the-counter things. So always make sure your doctor is aware of any over-the-counter remedies you might be taking if you're on an ACE inhibitor. Side effects of the ACE inhibitors, dizziness or headache can be a result of, the lowered blood pressure in itself. You might have some drowsiness or diarrhea, weakness, and cough is one of the most common ones that annoy people. Rash, metallic taste can all occur as as a result of ACE inhibitors. The ARBs, again, they act by reducing the blood pressure. That reduced blood pressure helps your heart pump better, because if the blood pressure is lower, then it doesn't have to push so hard to get the blood out. These drugs can also help prevent the progression of kidney disease caused by high blood pressure or diabetes. Just like the ACE inhibitors, they have similar names, end in artin. So a few different ones, but for the most part, they end in the same 4 letters. And their side effects are almost identical to the ACE inhibitors, as you can see here: cough, low blood pressure, dizziness, headache, rash, metallic taste, flu-like symptoms, sinusitis, maybe even some respiratory side effects. The serious ones are kidney failure. So if your blood pressure drops too low, then you can have kidney failure, which can also, mean you could get liver failure. You could have an allergic reaction. A decrease in white blood cells is dangerous because that could lead you to increased risk of infections, as can a decrease in platelets would make you more prone to bleeding. So, of course, any ARB can interact with others. So it's not important that you know what these are. It's just, something to be aware of, something you can refer to down the road. Or if you want to learn more, they're all listed here. But your doctor and your pharmacist will always be monitoring what other drugs you are on, so that you're not inadvertently placed on a drug you shouldn't be, or that you're monitored more closely if you are on a drug that might interact with it. Beta blockers block the hormones adrenaline and noradrenaline. That's the fight or flight response. So you don't want your heart all stressed out. So that's why the beta blockers can help with heart failure. It can also result in reversing some of the damage to your heart if you have what's called systolic heart failure, which is primarily from the pumping or the ventricular action of the heart. Beta blockers, here's a list. They tend to end in OLOL. List of those. And some of the side effects: cold hands and feet, fatigue, dry mouth, slow heartbeat. The slow heartbeat and fatigue are probably interrelated. You can get weight gain and swelling of the hands and feet. It can trigger an asthmatic attack, otherwise known as bronchospasm. You can get really cold hands and feet, uncontrolled heart failure. So any worsening symptoms, if you're placed on one of these or your dose is adjusted, you need to let your doctor know. There's interactions with other drugs, as you can see here. They don't list the grapefruit here, but some of these drugs, your doctor will tell you not to eat any grapefruit. So make sure you discuss that with your doctor, as well as look at these other types of drugs. So diuretics, as we talked about, try to keep the fluid status of your body in equilibrium, so your heart isn't stressed with trying to pump too much blood around, because the amount of fluid you take in, oops, let me go back, sorry. The amount of fluid you take in goes directly into your gastrointestinal tract, which then go into your blood system. So diuretics help you get rid of that excess fluid so that your heart doesn't have to pump harder. But they can also cause changes in your electrolytes called potassium and magnesium. And both of those are important because excess potassium can lead to problems with arrhythmias. So you never want to have excess or too little of potassium, for that matter. But excess is definitely more concerning. There's 3 types of diuretics. Thiazide tend to end in thiazide. The loop diuretics, Lasix or furosemide, and the potassium-sparing diuretics like spironolactone are fairly common. And it just depends on your potassium status or how well your heart failure is controlled. They may be using some of these together, more commonly by themselves. Carbonic anhydrase inhibitors. See, I can't even say these words. And there's osmotic diuretics. Very rarely used, maybe in a hospital setting. Side effect, of course, of diuretics, since you're losing excess fluid, you might be thirsty, have a dry mouth, be restless, or even get muscle cramps. A lot of times people who get dehydrated, one of their first symptoms is a muscle cramp. So make sure you always hydrate yourself if you start to get muscle cramps. Of course, low magnesium can cause muscle cramps as well. So diuretics are usually well tolerated, but they can have side effects. They, of course, can interact with some common drugs, especially if you have diabetes. So those doses may need to be adjusted. Again, your doctor and pharmacist will advise you of the proper changes. Don't make those changes on your own. We are happy to help you manage those problems or concerns. You know, more of the same, why they're used. They help you live longer with heart failure. Again, the big concern is elevated potassium. So watch your potassium intake, like bananas. But other than that, you should be able to, you know, have a healthy diet and just watch that. And your doctor will probably check your potassium level and other blood levels periodically. Of course, if you have severe side effects from any drug, including these, like trouble breathing, swelling in your face is especially alarming, lips, tongue, throat, if you're confused, numbness or tingling, hives, you know, anything like that, you need to report to your healthcare professional immediately. Again, there's a lot of interactions, drug interactions. We don't expect you to know them. It's good to be aware of them. There's so many and they're so hard to know all their singular names. It's just important that if you're placed on a new drug, that the doctor knows all the other drugs you are taking. That's the most important thing you can do, is make sure you have a list of your drugs, all the dosages, how often you take them, how long you've been, when you started them, and things like that. Lanoxin or digoxin, it helps with heart muscle contractions, and it helps reduce the symptoms of heart failure, and is also more likely to be given if you have a heart rhythm disturbance. Side effects, dizziness, maybe a fast pounding heart, since it's trying to make your heart beat a little faster. You might notice that. Rare would be things like black tarry stools, which could be from some sort of GI bleeding in your gums, any sort of bloody side effect, rash, stomach pain, or anything unusual needs to be reported to your doctor. They usually measure digoxin levels to make sure they're in their therapeutic range. Lanoxin can interact with other diseases that you might have. Again, this will all be assessed before you're put on this drug, or you may be monitored more frequently with blood tests or other tests to make sure that these other conditions aren't getting worse in any way. As you can see, there's quite a few of them, like thyroid problems, thiamine deficiency, which is a B vitamin. So, you know, you need your heart to live. So unfortunately, sometimes the heart just doesn't do that well, but there are ways that we can make you comfortable, ease your symptoms, improve your quality of life. Hospice would be for someone who would not be a transplant candidate. So they would optimize your well-being, relieve symptoms, try to keep your heart pumping and your symptoms at their minimum. So what can you do to prevent this problem or prevent your heart failure from worsening? Well, you really need to stop smoking. There's lots of ways to do that. There's a lot of stop smoking programs. There's drugs to help you stop smoking, hypnosis, slow withdrawal and stuff like that, different gums. That would be the number one first thing you should do. You know, obviously, you know, your activity and your weight monitoring is important. So depending on your level of heart failure, you know, activity is going to be encouraged most likely so that you don't gain more weight. You'll need to always check for extra swelling, eat a healthy diet, keep the sodium level in your diet lower, because sodium makes you hold on to water, stresses the heart. Get your vaccinations, watch the trans fats, basically anything in a package or a can. Are probably not the best for you. The best things are to shop at the grocery store and, do the perimeter, everything on the perimeter, the fruits, the vegetables, the fresh meats and so forth are much better than anything in a can. And frozen foods definitely better than anything in a can. The can's your last resort. Alcohol and fluids, obviously limit alcohol and don't drink excess water. Drink to ensure that you're not thirsty. Try to be active. Keep your stress low. If that needs to be yoga, meditation, counseling, whatever it is, take a walk. Stress does not help a failing heart. Now, these are some things the doctor might ask you. You've already probably been asked these questions, so I don't think we'll go into those. Obviously, they monitor your blood pressure carefully, your respiratory rate. They'll often measure your oxygen status. And, you may think, why are they doing these weights on me every time I come into the office? It's only been 1 month. Well, that's primarily to see if you're retaining fluid. So don't think it's anything about problems with eating too much, but you should watch what you eat. Again, they'll ask all sorts of, degree of questioning depending on how severe your pain is, when it started, what aggravated it. It's the typical health professional way of getting to the bottom of what's really going on with your new symptoms. Well, that completes our coverage of heart failure. I hope you enjoyed and learned some interesting facts. You can visit this and learn more about heart failure by visiting our website, and we look forward to discussing more topics in the future. Have a great day. Thanks.